Hello guys, it's your girl Janet and I'm back again with another video. And for those who are new to this channel, I'm a medical student in China, and this channel is specially made for medical counseling, different medical topics. Stay tuned for today's topic. So today I'm going to be talking about breath holding spell, which is a pediatric topic. So breath holding spell is an episode or episodes in which a child cries, and this could be as a result of increased heart rate or change in breathing. An increased heart rate or change in breathing could be as a result of strong emotions, painful stimulus, fear, hunger. These things could cause increased heart rate of a child or change in breathing of a child, and this could result to hypoxia, hypercapnia, cyanosis, loss of consciousness, decreased muscle tone, and so on. And breath holding spell is characteristically known to last for just within 1 minute. If it lasts for more than 1 minute, then resuscitation is indicated. It is very common within, or it starts within 2 to 18 months. From 2 years old and above, it is very rare, and it occurs both in male and female, though it's more in female than male. So breath holding spell are mainly of two types: pallid and cyanotic. Pallid could be as a result of fight, pain, or falling with a minor injury to the head. So what really happens in pallid breath holding spell is that after the child feels pain as a result of the fight, the child gasps and gives a brief or no cry. If there is a brief cry, it's for like 2 seconds, and then after that the child becomes limps, loss of consciousness, and becomes pale. During this loss of consciousness, the child will become sweaty, stiffen, and a few body jerks, just like in epilepsy. So the child would have a few body jerks and might lose bladder control. And like I said, this episode lasts for less than or within 1 minute. So within 1 minute, the child gains back consciousness, but then the child would still feel sleepy. He can't see people, but it's like a bit blurry, and the child feels sleepy. He might sleep for several hours before fully regaining strength. So that is pallor breath holding spell. And then for cyanotic breath holding spell, these ones are caused by anger. When the child is angry, frustrated, experiencing strong emotions, these things cause cyanotic breath holding spell. So in this cyanotic breath holding spell, after the child goes through this strong emotion, the child cries vigorously. In cyanotic, the child cries longer than in pallor. In pallor, the child will only cry for like 2 seconds, but in cyanotic, the child can cry for over 15 seconds. After crying, the child just becomes silent, stop breathing, and becomes blue, mostly on the extremities. Not totally blue, but like bluish extremities. And then the child would lose consciousness, become limp, and stiffen, just like in pallor. And like normal, the recovery is in less than or within 1 minute. So when the child recovers, the child gasps while recovering. We should remember that in pallor, the child gasps before loss of consciousness, while in cyanotic, the child gasps after consciousness, and after that the child might seem really tired. Since this breath holding spell is very similar with seizure, I'm going to give you some characteristics or some things to use to differentiate it from seizure. Although a child with breath holding spell has a very high risk of developing seizure when he or she grows. So the number one feature is that in breath holding spell, it begins in a specific age within 6 months to 18 months. Meanwhile, in seizure, it occurs in any age. And then breath holding spell has a provoking factor. It could be strong emotions or painful stimulus. Meanwhile, in seizure, it has no provoking factor. Breath holding spell cannot occur during sleep, while seizure can occur during sleep. Breath holding spell do not lead to urinary or fecal incontinence, while seizure does lead to urinary or fecal incontinence. So those are the few ones I can give, but there are many more. So now for the management for breath holding spell, the first one I would say is stay calm. Always stay calm when these episodes happen, and make sure you do not move the baby. Try as much as possible to let the baby's head be lower than the baby's body in order to avoid prolonging the episode, because when there is no blood supply to the head, the episode can be prolonged. So when bending the head, it causes blood supply to the brain. If the child does not recover within 1 minute, CPR should be done, that is, resuscitation should be done immediately. Although anger, frustration, all these things can precipitate breath holding spell, try as much as possible not to alter any customary discipline as a result of fear of precipitating the breath holding spell, because it can lead to behavioral problem of the child. And then rule out iron deficiency anemia if breath holding spell is frequent. Iron deficiency anemia should be ruled out. There are other medications that could be given for breath holding spell, which I would not be mentioning in this video. If breath holding spell occurs, always make sure to visit your healthcare center for more information and for more medical details. Thank you so much for staying to the end. Hope to see you in my next video. And before we go, please guys, make sure you click that red subscribe button down there, share this video, and comment down below which medical topic, mostly in orthopedics and pediatrics, you would like me to discuss on. Thank you so much. Hope to see you next time.